Hi, everyone, and welcome. We are going to be talking about belly fat and how we can burn belly fat with eating healthy foods. So this is based on a Dr. Jocker's article, and I wanted to thank Jordan, who is one of our co-op students here at Justine-Blainey Wellness Center, for putting together these wonderful slides. If you have any questions, please feel free to give Dr. Justine a quick text. I wanted to welcome Dr. Justine. She is our leader here. Her main objective is to provide you with the best care for you and your family so that you can be the best version of yourself. And Dr. Udani is our naturopathic doctor at our center, and she has some really great special interests in women's health, digestion, skin, chronic pain, and stress. Please help me welcome both Dr. Justine and Dr. Udani.
I love that original picture with the raspberries that Jordan put there because I love raspberries. And it's one of the fruits that's low glycemic. As we're going to be talking about sugars with belly fat, raspberries would be the healthier treat, or berries in general, healthier treat to have to get that sweet tooth. Coming up, we have our Sit and Fit, a talk on cholesterol, and getting to learn more about emotional release, cranial sacral therapy, how stress can be caught up in our muscles with our new massage therapist, Edwin. He's at our center on Tuesdays, and that's a much more customized massage approach to look at how stress is affecting your muscles. So stay tuned with us for upcoming talks because our goal is to learn one new thing every single week. And that way you're over 50 times better by the end of the year. So what is this belly fat? Well, we have different kinds. As most people think about that subcutaneous fat, that's kind of the one you can see and touch when we think of those love handles or belly rolls. But the dangerous one is the one you can't see, the visceral fat. That's the one that wraps around our organs and leads to chronic disease like diabetes, heart disease, affects hormonal issues, metabolic disease, and can affect mental health. So, our goal today totally is to learn more about fat and ways to manage that fat. Now, the visceral fat, like that's the one that I was saying the most dangerous around your organs, is more common in men, around 10 to 20%, and a little bit less in women. But that is the one that goes up with stress. It can affect metabolic syndrome. It can affect insulin resistance. It can increase your inflammatory cytokines. So this is the dangerous stuff. Now, subcutaneous is the one that looks bad. If we go back a slide, that's the majority of our total body fat, that BF. That's the stubborn fat. And estrogen for women can play a big role. And this is the one that is typically very hard to remove, the one that people complain about, but also the one where lifestyle can make a major difference. So we're going to be talking about these areas of fat with Dr. Udani and myself.
Yes, so like Dr. Justine mentioned, the subcutaneous fat is the fat you can touch, the one you can pinch, but the visceral fat you can't really pinch, and it's just kind of cushions the organs. And this is the fat that is very highly hormonally active, and it can release a lot of inflammation, and it can increase your risk of things like, stroke, diabetes, cancer, dementia, arthritis. And, so yes, if you are overweight, you are going to have more of that visceral fat because of, because there's more fat in general. But even if you're skinny, you can have a lot of visceral fat. So if you have that bit of that pouch or that belly, that is actually a sign that you can have more of the visceral fat than like somebody that might have more weight on their hips and thighs. So that belly fat is really the fat that we're going to look into here and how to burn it, because it is what really causes increase in the chronic diseases. So because
sorry, Dr. Udani, you are able to test for some of this. If you look at the picture, you can look at your interleukin, you can look at your C-reactive protein, that's the CRP. So as a naturopath, including for myself as a patient of Dr. Udani's, I'm going to get much more intensive blood work. Even when I went to get my blood work that was assigned to me, to get from Dr. Udani, the technician at the blood lab was like, "Holy cow, you're doing way more." And I'm like, "Yeah, this was ordered by a naturopath, not by a medical doctor. So if you want intense testing, you want to go beyond what you get with your medical doctor.
Yes, absolutely. Thank you, Dr. Justine. Yes, because we want to get the full picture, and really, we want to test. We don't want to guess. And I definitely want to, I definitely order more to get a more comprehensive test picture what's going on. And and that's because you deserve it, especially when it comes to stubborn fat, or if you're feeling like you have family history of diabetes or high blood pressure or stroke. We want to really figure out what's going on. And one of the big things with belly fat is insulin resistance. So the more fat you accumulate, the worse the insulin resistance gets. And when our insulin resistance is bad, that's when we can have a lot of these other things like stroke or diabetes, increased risk of cancer. And so we're going to go a little bit deeper into that in the next slides. So really the thing with insulin is it is the hormone that our pancreas produces to control blood sugar. So when you eat any meal, your blood sugar spikes, right? It goes up. And in order to get that sugar into our cells so that it can use it as energy, we need insulin. So insulin acts like a key. It opens the doors for the sugar to go into the cells. And if you're healthy, if you're eating a good protein-rich, fat-rich meal with the carbs, it is all good. But over time, let's say your diet is high in sugar, high in the simple carbs like white bread, white rice, and not a lot of protein and not a lot of healthy fats to balance that. The body needs to dump a lot more insulin to manage to get that sugar into your cells. And over time, the pancreas gets really tired, and this can really affect something called insulin resistance, where your body just gets resistant to the insulin. So you need to produce more and more to try to get that down. And this actually can become a cycle where you're trying to control the blood sugar, but it's not going down. So you're producing more insulin, and it's still, but the cells are not responding to it like it used to. And because of that, it just keeps happening in a cycle. And this is where you get, this can affect the chance of you developing other issues because of the inflammation it releases and it produces.
If we get into that chronic inflammation, which tends to be if we have too much of that blood glucose, this is the white stuff, the white rice, the white pasta, the white potatoes, the cookies, the candies, or it sneaks up on you on sandwiches, or, oh, I'm just having an egg McMuffin, right? Chocolate candy bars, lots of chocolate milk, soft drinks. Many of these high sugar foods get into our bloodstream quickly, so we feel that bit of energy to feel like we get through the day, but actually chronically it's affecting our insulin and leading to insulin resistance and more cravings, meaning like you think you're just having it once, but then you crave it over and over again. The more you have, the more you want, the more gain, the more visceral fat. And again, like Dr. Udani said, doesn't mean you have to look fat. My brother used to say a skinny fat chick, like it means you can still be very looking slim on the outside, but have visceral fat on the inside. So we want to stop this cycle, this insulin resistance. And the first part of that is to test. How are you doing? How do you know? You cannot look at the outside and know how you're doing on the inside. That's looking at a car and not driving it and buying it. You don't look on the inside of the car. You don't look at the engine. You just look at the pretty, red color and you say, I want the car. Nobody does that. You want to test and know what's happening underneath.
Yes, absolutely, Dr. Justine, because sometimes, just because you look skinny, you think, oh, I'm healthy. But really, no, that does not really mean anything because you really want to get tested to see what's happening on the inside. There's a lot of skinny people that have high blood sugar or high inflammation markers, but we just need to really test first to guess instead of guessing. And this is what I mentioned
as a story, Dr. Udani, sorry to cut you off. I remember my dad bragging, in his late 60s that I'm not on any medications. He had a belly. I'm doing fine. I feel fine. I can golf. I can walk the golf course. But it does catch up with you eventually. So even if you have that bit of a pouch, a bit of a belly, and you think, well, I'm fine. My blood pressure is fine. My cholesterol is fine. It still catches up with you. And that's why you continue to test and continue to try and just do a little bit better.
Yes, exactly. So this is what I mentioned with that cycle with insulin resistance is when you eat lots of carbs, lots of that white foods, high sugar, and that's going to really increase your blood sugar levels. Your pancreas releases insulin to open the cells up to get that sugar into the cells. But what can happen is over time, this cycle your pancreas can get really tired of releasing too much, releasing insulin, and insulin actually stops getting working as effectively. So that key doesn't work as well. It starts jamming, and so your blood sugar starts to rise up and creep up more and more. And this is actually something that I test with my patients every year. We check their blood sugar to see, okay, how is it doing? Because we want to keep an eye on it. And so this becomes a cycle, and your body just gets very resistant to insulin. And that's why one of the biggest things we want to do when we're trying to burn belly fat is to manage your blood sugar. Keep it stable, make it so that you're not being insulin resistant. So we want to make sure we have stable blood sugar. So our diet should have not a lot of refined sugars, processed junk food, bread, sugar. And I get it. Sometimes when we want to cut this down, it can be hard because we're used to it, and our taste buds are used to the sugar, the sweet. So the cravings can be really a lot. So I definitely help my patients figure out a plan that works for them. So I know Dr. Justine does the same as well. So we work as a team, and we want to make it so that it is doable for you. And we want to, so it might be just like something like small, like switching from white bread to brown bread and rye bread or sourdough, something a little bit more complex, healthier for you. We want to add more protein, healthy proteins, lots of fresh, low glycemic fruits and veggies like the berries, and fiber that can help with balancing your blood sugar. And there's definitely a lot of supplements in the market too that can help with balancing your blood sugar. So we're going to go into the 3 blood sugar tricks and jump right in. So number 1, balancing your diet for better health. Making sure, like I mentioned, with the meal, you want to have a healthy source of fat, healthy source of protein to really balance the spike in the blood sugar that you might have. So, for example, my dad, before, he would eat three times a day, big plate of white rice with a little bit of, a little bit of vegetables, a little bit of fish, but it really wasn't enough. And his blood sugar started to rise. And my dad is a little bit on the anxious side. So he was like, he went and he got it tested, and he realized, okay, I need to make a change. So the first thing we did was we cut out the rice. So instead of having 3 meals, we made it so that it was 2 meals. And then we did half the portion that we did that he was doing before. And we added a lot more veggies, a lot more good quality things like, fish, wild caught fish, farm pasture raised chicken, things like that, to balance his blood sugar levels. And he actually became, his blood sugar went back to normal. So having a good quality diet can be really beneficial. And if you do need help with this, we're here for you. You also have an amazing nutritionist in our team as well. And you want to be able to have, like I mentioned, the good quality fats like olive oil, coconut oil, avocado, having at least 30 to 50 grams of protein in each meal. This can be different from person to person, so it's important to have somebody on your team to have it individualized for you. Walking is really important too, especially after a meal. I tell this to all my patients. If you have a heavy meal, especially during holidays, get your butt up, go for it, at least a 10-minute quick walk in the neighborhood, something to kind of move, because movement also helps with insulin resistance. And you can even start your day by drinking a little bit of 1 to 2 tablespoons of apple cider vinegar with water to jumpstart your digestion process. And one of the biggest ones is eating some good quality protein and good quality fats with your meals. It's number 1.
And this can be done eating out. I know a lot of people say that it can't, but we had my son's birthday recently, turning 21. So we took him to the keg as that was one of his favorite places. But you know what? You can order cauliflower mash instead of potato with sour cream and all the butter and all the bacon right on top. You can make healthier swaps at restaurants now. It's just a matter of asking. For example, skip the potatoes, skip the fries, go for the salad on the side, salad dressing on the side, so you can limit the poor salad dressing choices that can often have bad fats or lots of sugar in the salad dressing. So these choices can be made even if you're having a dessert. I mean, it was his 21st birthday. We had the five of us, but we ordered one dessert with 5 spoons, So you can find ways to still do this and be celebrating, is my point. And not make, and also, I guess, in that sense, you're saving money, right? As well. So, even alcoholic drinks are going to, on a celebration, right, looking towards one instead of like three, and that makes a big difference. Really enjoying and savoring that drink, asking for it to be in a bigger glass. So say if you're having something with soda water, you can ask for a 20-ounce glass with soda water and the alcohol of your, like, gin and tonic kind of thing. So it's lower calories when you're on the holidays, but you're having a larger drink, so it takes you longer to drink it, right? To make it easier for yourself. Now, as we get into intermittent fasting, this is a huge success for helping to control your blood sugar levels. And so this is something that I typically like to do 3 to 4 days a week, is not eating breakfast as that first thing in the morning, delaying your breakfast. You still want to break your breakfast with a healthier meal. So one of the things is that intermittent fasting, your breakfast could be your biggest meal, but having it at lunchtime. So it's going to help with insulin resistance, going to help with autophagy, which is getting rid of those bad cells, reducing risk and reducing belly fat. So you're eating in a shorter window. Similar with the protein pacing, instead of large amounts of protein 2 to 3 times a day, you're having smaller amounts of protein more frequently. So in that 8-hour window, when you start intermittent fasting, that might mean saying your first meal of the day is at noon and you're eating between 12 and 8. And then so in that 12 to 8, every 2 hours for the protein pacing, you're looking towards adding protein. And that could be, when you're getting started, a protein bar, a protein shake, cottage cheese. Mm-hmm. One of the things, I love soups in the winter. So adding cottage cheese into your soup and pumpkin seeds, and then adding some avocado for your healthy fats, that makes your soup feel bigger, more full. But you're getting more protein more frequently. So definitely talking to the naturopath as you're getting started with your intermittent fasting. And then you can get better from that 8-hour window to a 6-hour window. We want to prioritize some of those healthier foods with your intermittent fasting. So you'll see all of these benefits with intermittent fasting affecting every single part of your body. But one of the ones I want to bring up is stem cells. There's more information about stem cells coming out. You can increase stem cells very expensively if you want, through guided ultrasound injections, but that can be in the range of 15,000 plus, or you can look at stem cell patches, which are ways to increase your stem cells, or even better is intermittent fasting to increase your own body to make healthier, younger cells with, and that's that stem cells. So that will help you detox the junk and bring in the new. So lots of benefits, lots of great hints as you get started with intermittent fasting. Just definitely looking in that intermittent fasting, you're not limiting your calories, but you're definitely focusing on quality foods, clean foods.
Yes, and I like to add something there, Dr. Justine. Try not, because you have that fasting, the window of eating, you're also limiting your snacking. So you're not snacking, throughout the whole day. You have this time where you're eating, because the snacking can also spike your insulin and can make your hunger hormones go all out of whack. So intermittent fasting can be a great way to start. I do want to say, if you are starting intermittent fasting, we want to make sure your stress levels are good, your sleep is good. Otherwise, sometimes it can, it can make things a little bit more tricky. So definitely talk to myself, so that we can figure out the right one for you, right routine. So number 3 is minimizing toxins. So, there's a lot of toxins out here. A lot of the things are synthetic, chemical, man-made. So it's impossible to avoid all of them, but it is really important that we can limit whatever that we do come into contact with. So even, when we think about food sources, the conventionally raised animals like the chicken, the beef, the goat, they're kind of fed the same diet. There's fed with antibiotics, so that gets passed down to us. Even things like the plastic packaging. If you see takeout containers, right, and it's all made out of styrofoam or plastic, and it's the hot food is in there, all those toxins are going to leach into the food. So keep an eye on that, being mindful, maybe not to order as much takeout because of the impact of those toxins have in our body, is really important too. And we want to choose healthier options. So if possible, always go for organic. Look at the organics label to know that it's raised properly. Go for the free range animal products, the wild caught fish, the salmon, and because that's really going to help minimizing the toxic amounts. And there's some other ways we can reduce it too. You want to use the like I mentioned, the organic foods. You can even have high quality air filtration. So this is something I tell my patients, especially if they have nasal congestion or if they've been working in areas with lots of dust, old buildings, to have something like that running in their bedroom, so that way it's helping clear their lungs out of any kind of toxins. You want to use high quality water filtration. For example, my brother lives in Guelph, so there's a lot of hard water in Guelph, and he has a water filter, so that way he's not having all that hard water. He's not drinking it every day, because it does accumulate in your body. Using natural household cleaning products. There's a lot out there in the market. Thankfully, we live in a great age where there's a lot of good, high quality natural products. But even some simple things like baking soda and vinegar can be really good for cleaning your house. You want to check your even the skincare, the creams that you're using, so make sure they're free from parabens, sulfates, excess perfumes, because that will also affect the toxic body burden. And of course, cutting down your alcohol, the smoking. These are the biggest forms of toxins in our body that really slug mess up and make our liver sluggish with detoxing, and they end up adding into our inflammation load. So like we mentioned, we want to maximize the nutrients, so we have lots of high quality, good nutrients for our in our foods. Nutrient dense foods. So we want to avoid the white bread, white pasta, the carbs, but we want to add in some good quality carbs, things like sweet potatoes, things like cauliflower. They're starchy veggies, so there's lots of carbs in that, but it's good quality. We can have also lots of farm free range chicken, meat, animal sources, healthy fats like avocado, olive oil, coconut oil, and lots of berries, lots of color. Look for lots of color in your plate. That tells you that you're eating. When you eat the rainbow, you are getting all the benefits of the rainbow into your body to help with cutting out belly fat and also reducing inflammation. Some of the top foods that can help burn belly fat, and you'll notice is there's a lot of protein here, because protein definitely helps you burn fat faster, and it also doesn't spike up your insulin. It doesn't spike up your blood sugar. So grass-fed red meat, pasture-raised eggs, wild-caught salmon, these are great sources. And so we also have some great fats here as well: extra virgin olive oil, avocados, coconut oil. They also don't raise your blood sugar. Actually, olive oil can really help your pancreas healing and repairing itself. So I always tell my patients, drizzle in olive oil with anything you eat. It's have it cold. That's the best way to have it. Don't try to cook too much with it. You can even drizzle it over your salads, over your carbs, whatever. You can have it. It is a great addition. Lots of great bitter herbs and veggies like arugula, ginger, parsley, artichokes are really great for your liver. So it helps the liver flush things, excess toxins out, helps the detox. Same thing with apple cider vinegar. It gets your digestive system going. There's actually a lot of research on apple cider vinegar helping with belly fat. If you started with 1 to 2 tablespoons a day with a little bit of water, it really jumpstarts the fat burning process. So this is a summary. And is that me? Yes, that is me. Okay, so like I mentioned, grass-fed red meat. Grass-fed is highly recommended because we know that, we are what we eat. So if you have good quality meat, it's because of what they eat. So, lots of, when you're eating grass, there's a lot of nutrients and minerals that these animals eat, and we're getting that into our system as well. And it's high in conjugated linoleic acid, which is really great for helping with burning fat too. So always try to go for grass-fed red meat. And these are some of all the nutrients that you really get when you have high quality meat. You get lots of B12, lots of iron that you need for energy, zinc, lots of great other minerals and nutrients that our body uses to boost our metabolism.
All right, so that's number 1, healthy proteins. And going along with number 2 is pasture-raised eggs. You don't want chickens that are all cooped up. We want to make sure that the animals are pasture-raised. They're not confined so that you get the highest value. Yes, they're a little bit more expensive, but there's more in it. It's more quality. You're going to get more of those essential nutrients, more of that vitamin K, vitamin A, better protein, better choline. And choline can be helpful for your brain health, for your liver health. It can be great for athletes. So I know I grew up, if you were supposed to only have limit your eggs because of cholesterol. That is old news. All right. Now we know that you can have more eggs more frequently, and they're really good for you. So if you look at the top nutrients in your eggs, you're getting that vitamin K that's going to help with your cardio health, help your vitamin D work better for your immune system. It's going to help your thyroid function, your cell walls. It's going to help your CLA, which is going to help your cells be stronger, your choline to help communication. So really getting top quality eggs into your diet on a regular basis can make a massive difference. And this doesn't mean cooking it in with baked muffins, all right, where you're getting that white flour. This is omelets. This is adding eggs for healthy, say, protein pancakes in the morning. So you're not looking at just flour pancakes. You can ask about amazing recipes for eggs with our naturopath, with our nutritionist.
Yes, and number 3 is extra virgin olive oil. So like I mentioned, it is amazing. It's a superfood. Make sure you get it in the one in the glass, the dark bottles in the back of the shelf so that stays fresh and with lots of antioxidants. It really helps with inflammation, making sure that your body is not inflamed. And this is what we test for to get a good view of how your inflammation markers are doing. Olive oil is amazing for your good cholesterol. It's great for your heart health. And you want to really use this more like a drizzling over foods or very, very, very light cooking, because olive oil can get damaged easily. So we don't want to be having damaged olive oil. We want to have the good quality, the nice ones, to help with the weight and for overall inflammation. So some of the nutrients in olive oil, we have oleic acid. This is amazing it's a great fatty acid that helps with blood sugar stability. We have phytosterols, vitamin E, amazing for your skin. I even tell my patients, use it on your skin because your skin can absorb it as well. It's a great way to moisturize your body. Phytosterols are amazing for helping with boosting insulin, cholesterol. There's a lot of other great polyphenols, which think of them as inflammation fighters in olive oil that help very much with fat burning and also reducing other risks of other conditions. Apple cider vinegar is number 4. This is amazing for improving fat burning, helps with digestion, gets your body kind of ready to digest food, improves your stomach acid levels too. And it contains probiotics, so it can help with kind of healing the gut as well. So you don't need too much, just a little bit. And this is something that, let's say you do have acid reflux, you want to come talk to a naturopath so that we can figure out if apple cider vinegar is the right thing for you. It usually is, for the most part, very, very safe and very effective. But just to be safe, we want to have that conversation. But apple cider vinegar, I know it tastes a little off, but really, once you get into it and the routine, it is amazing. Another great addition to have. And number 5 is actually one of my favorite spices, ginger. I have it every day, because it helps with sore throats. It helps with colds and flus. It's great for digestion, great for actually nausea as well. So if you have feeling nauseous, ginger is amazing to settle your stomach. So even things like bitter herbs, like I mentioned, they really help with boosting your liver function to help detox the body. And so really, if these things are, you might be able to find them in your kitchen. Easily, you can find these at any grocery store. So try adding a few into your diet. Maybe you can make a ginger tea today. And so that can help with digestion in that way.
All right. So, go ahead, Dr. Danny. But I was just going to say, if at the beginning, if you're not used to how to add these herbs and these bitter herbs, or how to add apple cider vinegar, that's when you want to do a consultation and get some help. It's okay to get some coaching along the way.
Absolutely. Thank you, Dr. Justine. I agree, because sometimes this information can be like, you might not know where to start. And that's where you have a team where we figure out what works for you and how to start it. So like I mentioned, ginger is so full of amazing things. It is a little spicy. So, if you wanted to have in a tea form first, you can do that. There's good quality supplements as well. I always say, try to go for the fresh one because you have all the freshness in there. You can even mix it with a little bit of honey, but it is a great herb to have in your cupboards.
And the number 6, as we're getting towards the number 7, is adding wild caught salmon. That's literally what we're going to have for dinner coming up this weekend. It's going to have those good fats, good proteins, astaxanthin. All right. So that's something that's going to help reduce inflammation and reduce obesity. So looking at a healthy fat and anti-inflammatory fats with that wild caught salmon. If you look at the wild caught salmon, you'll see all of these amazing minerals that are there. But careful, if you got farm salmon, you could be adding mercury unintentionally. That means that the fish is basically swimming in all the poop of the other fish. So definitely look for wild caught salmon as one of the ways to reduce belly fat, and look to try to have that once a week at least. Next one is looking at avocados, and I love avocados. First of all, they just make you feel full, right? And they take on the taste of whatever they're in. So if you don't like them, mush them up and put them in something else, and you won't taste them. You can put them as ice cubes. You can buy avocado ice cubes from Costco in a bag, so that easy could add to your smoothies. You could add them to your salad dressings, add them to your salads. Lately, I've been adding them into my soups to help you feel full. But this is going to help you with that glucose tolerance, help you with that belly fat. So when you look at all the advantages, it's helping your heart, it's helping your digestion, it's helping your strength, it's helping your skin, your nails. Avocados are the way to go. I know people used to think that because it's fat will make you fat. And that's just not true. An avocado a day or avocado every other day is amazing in order to be able to add to your diet to get the best results and reduce that belly fat. So we just covered 7 amazing hints for you to be healthier, reduce that belly fat. But along with that is you do need to reduce your stress. If you're on your stress and you're toxic, you're going to hold belly fat. And so with chiropractic, you're going to help the spine and nervous system reduce that stress. With acupuncture that Dr. Udani does, you're going to reduce that stress and helping the brain and body communicate better. So make sure you get those checkups for your spinal health, for your stress, for your blood work to know if you are at risk. And that's why we're here providing all of this information for free for you, for your family. Pass it on and make sure they get their checkups wherever they live. And if they don't live locally, Dr. Udani does her work also virtually, and I would be happy to do a referral for you in order to get a proper spinal checkup wherever you live. So we're here to help you, to support you. We have amazing topics upcoming. Sit and Fit, I had it vetted by my mom to make sure it was great. It's 10 minutes. You can do anywhere and on the go. If you have no time, you can do this Sit and Fit at work, easily in your work chair. All right. We have talking about cholesterol because that can sneak up on you silently, and learning about how emotional stress affects your muscles with our registered massage therapist and registered acupuncturist, Edwin. So we have some information plus a demo. So stay tuned with us, connect with us, learn one new thing every single day. Please do a review. This is our volunteer time to support you and give back to you and your families. Have a wonderful night.
Have a wonderful night, everybody. Thank you for tuning in.